Now, from the News Channel 5 network, this is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday. I am so excited about this show because I think I could fill the next hour with questions, but this show is about you, so feel free to call in. We're going to get those calls started. Tonight's topic, we're calling it All About Skin. Our guest here, a dermatologist, Dr. Binhlam. Dr. Binhlam, thank you for being here.
Thank you so much for having me here. I am very excited to be able to share my information about skin and everything about skin with you.
When I was reading over all the materials, I was kind of floored by how much you cover in your practice as a dermatologist. It's very much the medical side of things, but also the cosmetic side of things, and you guys cover a lot of ground between those two sides.
Right. You're absolutely right. There seems to be a lot, but really the field of dermatology encompasses all conditions related to the skin, hair, and nails. So not only do we treat conditions that are considered diseases of the skin and hair and nails, but we also are very involved with the health of skin, hair, and nails. And that's where we get into things that are more cosmetic and aesthetic as well.
We are taking your calls tonight. I told you I could fill this next hour with questions, so I have plenty, but I know you do too. We're talking everything from acne to skin cancer to Botox, fillers, all sorts of things tonight. So if you have a question, go ahead and give us a call right now. We're going to get those lined up. 615-737+ is the number to call. Also on Facebook tonight, we've already had two people chime in with Facebook questions. I'm probably going to get to those first. In fact, let's just start with the question. Stephanie Brown wrote in on Facebook, new treatment for eczema. Is there a new treatment that's out there?
Yes, there is. In the past, the traditional treatments have been things such as topical rub-on steroids, and there are also some oral medications. However, what's really exciting now is that there are new treatment options that include a topical medication called Eucrisa. That's not a steroid, so we don't worry about thinning of the skin. We don't worry about causing any possible acne-like reactions that are due to use of topical steroids. And then there's also going to be a new medicine that's an injectable medicine for severe eczema, and that is just coming out. So the field of dermatology continues to evolve with new innovations that will be very exciting for people who are suffering from eczema.
And let me back up that just a little bit. What is eczema?
Okay. Eczema is a genetic condition that causes people to get rashes very easily. And their skin is much more sensitive. Their skin also stays dry very easily because they're lacking certain proteins in the skin that helps the skin stay well moisturized so that it can act as an intact barrier to outside irritants and chemicals. Now, eczema can also be associated with hay fever, asthma, and so we see that also commonly. Also, eczema can also be triggered by environmental factors, including a lot of times chemicals that are in routine skincare products that people don't think about. But people who have eczema can become allergic to some of those ingredients, and there are over 3,000 chemicals out there that can act as a allergen. And so in the right circumstances, people with eczema will develop an allergy to ingredients in their own skincare products.
At some point in the next hour, I'm going to ask you what are the things that we should be doing to our skin or putting on our skin, and what are some of those things out there in the market that we should avoid at all costs. So that's going to come.
Perfect.
But we have people also on the line. Let's go to Casey right away. Casey, go ahead with your question. Thanks for calling in tonight.
Yeah, I was wanting to know what's the difference between fillers and how can they be used?
Okay, great question.
Right, so with fillers, fillers fill, and they're used in the cosmetic dermatology realm to help replace missing volume. And typically we're talking about using fillers on the face. It used to be that there was only collagen, and collagen used to be derived off of cow sources, and people had to have skin testing for that
to make sure they weren't allergic.
Exactly. Now there are different classes of fillers. So one large class is called the hyaluronic acid products, which are sugar-based molecules. And so those things are very safe. The risk for any allergic reaction is extremely low. And they typically last anywhere between 4 months to some products that can last up to a year and a half to 2 years.
Oh, wow.
So very long duration. It's also very safe in the sense that if people get a filler put in their face with a hyaluronic acid product, and if for whatever reason they don't like it, we can actually use another product called hyaluronidase that basically dissolves the product.
So if they don't, if they have a reaction or maybe say, oh, I wasn't going for this look, it can be corrected, so to speak.
Exactly. And then also there are other types of fillers that can also be longer lasting. Another type of product that can be used is something called Bellafill, which actually uses a particular type of plastic that has been FDA approved to be used for correction of volume loss on the face as well as acne scarring. And that product can last up to 5 years in individuals.
Wow.
So it's a long-term correction. And then we also have fillers such as Sculptra, which I call a dynamic filler, because after a series of injection, it actually forms a lattice work inside your tissue and stimulates your own tissue to create new collagen. So you get a gradual, natural filling of volume loss. And common areas in which we'll use fillers are typically along here, the nasolabial fold. We'll use it here, what we call the marionette lines. We will use it also up in the temples where people have hollowing of the temples with time. And also another interesting area that we'll use it in, a lot of people complain about dark circles underneath the eyes. And a lot of times that has to do with also volume loss with time. So when used judiciously in the cheek and tear trough area, we can actually recreate the volume that typically younger people have through here so that you don't have as deep of a dark circle, which is caused by a shadowing effect.
Very interesting. Casey, thank you for calling in with your question. Let's check in with Jeremy. Jeremy, what's your question tonight? Oh, Jenny, I'm sorry. Jenny, go ahead. I can't even read my own writing. That's pretty bad.
I'm calling for a relative, and she developed blotchy red lesions on her legs several years ago. Saw a dermatologist at that time who called it vasculitis dermatitis. He said the only thing to treat it with was some type of cancer drug, and she chose not to do that. So I'm wondering, is this something that a dermatologist should be treating, or should she see somebody, maybe an internist with a specialty?
Right. So that's a very intriguing question, and it's not as straightforward because there are many causes of, I think what you're referring to is vasculitis, which is inflammation of blood vessels. Dermatologists are also very skilled at treating vasculitis because a lot of times vasculitis can be caused by autoimmune conditions. They can also be caused by drugs. They can be caused by infections. And it comes down to figuring out, hopefully, what is the cause. And once you can figure out what is the cause, then you can choose the appropriate treatment. So it's not always going to be treatment with drugs that are high-powered chemotherapy type medicine. It can be treated by eliminating the underlying cause of vasculitis. So I would recommend that, I think you said it was one of your relatives, yes, that they may get a second opinion, maybe from another dermatologist. And if they can provide all the previous medical records, it would always be helpful to review the records and determine what needs to be done next.
Great. All right, tonight is all about your skin. We're taking a lot more phone calls, more Facebook questions right when we come back, so don't go anywhere.
Your retirement is right around the corner. You've worked and saved. Now it's time to put what you've saved to work. But where do you start?
Your first step needs to be a phone call to us here at Beacon Capital Management. We can provide you a free complimentary financial analysis. Don't wait. We can help you plan for your future.
Call the number on your screen now.
Watch The Income Guys, airing Thursdays, Saturdays, Sundays, and Mondays on News Channel 5+.
He stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner called Old Glory. Let us join our fellow man. History will write the story. America will always stand. History will write the story. America will always stand.
The Leukemia and Lymphoma Society is focused on curing blood cancers. You can help us find those cures by getting involved, having fun, teaming up with family and friends, and by joining one of our fundraising campaigns. Train with Team in Training. Walk to light the night. Sail with the Leukemia Cup Regatta. Become a man or woman of the year, or a student that saves lives. Get involved. Because when you do, you're not only helping blood cancer patients survive, you're helping them live. Join us and help us make someday today.
Welcome back to Medical Monday. Tonight is all about your skin and keeping your skin healthy. If you have questions, anything from acne to skin cancer to cosmetic questions about Botox or the latest treatment on the cosmetic side of things, go ahead and give Dr. Binhlam a call. We're answering tons of questions and we have a lot to get through. But first, I want to ask, whether you are 16 or you are 60, what should everybody be doing to their skin every day?
Right. And I think I can summarize it by saying sun protection, or I should say UV protection, ultraviolet protection, because you can obtain ultraviolet radiation from either natural sunlight or you can get it from the use of tanning beds. The American Academy of Dermatology has specifically said, and I definitely agree with this, that there is no such thing as a safe tan. And how I like to explain that is the tanning mechanism is a protective mechanism that your skin creates when it recognizes injury. So the very fact that your skin tans, it's because it's only recognizing injury. And one of the things that people don't realize is that when they have a tan and they say, I need to get my base tan before I go to the beach, the tan that they're talking about only delivers an SPF equivalent, sun protective factor equivalent, of about 4.
Okay.
Whereas the FDA recommends a SPF of 15. The American Academy of Dermatology actually recommends a SPF of 30 for everybody, from young to old. And that's very important because you're only going to have one skin to live with your entire life, and so you need to take care of it from the time that you're young well into your senior years. Over 1 million cases of skin cancer, new skin cancer cases, will be diagnosed every year.
1 million?
1 million every year. And actually, melanoma, which is one of the most deadliest kind of skin cancers, is the most common cancer among young people between the ages of 25 to 29.
That's scary.
And it is the second most common cancer in individuals between the ages of 16 to 29.
Wow.
And one of the things that people probably realize is that a lot of young people like to use tanning beds. And they use tanning beds in order to get color to their skin. And they're misunderstanding that base tan is protecting them against a sunburn. That misunderstanding is what leads them to get sun damage and therefore get not only premature aging of their skin, but also increased risk for skin cancer, including melanoma. And we do recommend, as far as sun protection, a SPF of 30, but use a broad spectrum sunscreen so that it covers against UVA and UVB. I myself also recommend that people should use a physical block as opposed to a chemical sunscreen. The difference is the following. When you use a chemical sunscreen does not work right away. You have to apply it and wait 20-30 minutes before it penetrates the skin and forms a chemical bond with the skin in order to serve as a protectant. And so that's why a lot of the labels for chemical sunscreen will say you need to apply it 15 to 30 minutes before you go outside. A physical block such as micronized zinc or titanium, as a physical block, it does not have to form that bond with the skin. As a physical block, it starts working right away. The fact that I said micronized zinc is very important because micronized zinc would not look pasty white on individuals.
It's not the white streaks that we think of, putting on your kids.
Exactly. So that, I think, is very important. And also, when you use chemical sunscreen, you can develop allergic reactions to the chemical. A physical block is inert, so it's not going to react like a chemical sunscreen.
Good information. Let's jump back to the lines. We have Shannon on the line waiting ever so patiently. Shannon, what's your question tonight?
Yes, hi. I would like to ask the doctor about the treatment of leg veins and about sclerotherapy.
Okay, thank you, Shannon. Go ahead, Dr. Binhlam.
So with leg veins, there are two types of treatment that can be used. And you want to think of it as injection of leg veins.
Are we talking about like varicose veins or spider veins? What are we talking about?
All that.
Okay.
So when we talk about leg veins, in my mind, I'm thinking of it could be anything from small little red tiny spider veins to kind of the smaller greenish veins to then even varicose veins, which are the big, thick, ropey veins. Okay. So the two main methods of treatment is going to be sclerotherapy, which is injection of leg veins. And right now there is a single product that's FDA approved for injection of leg veins. And it's a product that contains a chemical called polydocanol, which is FDA approved for injection of veins. The other way is going to be the use of lasers and radio frequency energy. You can deliver the laser from outside the skin for treating smaller veins, or you can deliver a laser fiber into the vein in order to heat up the internal lining of the vein and cause it to shrink and collapse. And you can also use a fiber with radio frequency energy that serves the same purpose.
So how do you decide which one to do?
It depends upon the size of the vessel, where it is on the legs. I find that a lot of the times the things that bother a lot of people is not per se the large varicose veins. It starts off with the small spider veins and what I call the reticular veins, which are the bluish green veins. And those things over time, when they don't get treated, they do start to expand and get larger and ultimately become varicose, which are the big, thick, ropey veins. So treating it early is actually, in a way, preventative.
Does it go away for good then, or is this a continuous thing you have to keep up with?
Yeah, the veins that are effectively treated are gone for good. However, there are certain factors that lead to the development of leg veins in general. And some of the common factors, unfortunately, number one is being female. Number two is pregnancy. Third is being on birth control pills. Fourth is being on your feet a lot. Fifth is going to be actually injury to the legs. Sixth is going to be smoking, gaining weight. So there's a lot of factors. So those factors will lead to the development of new veins.
This may be a myth, but I've heard it often. If you cross your legs, you're going to get these kind of veins. Is that true?
Actually, it's true to a degree.
Really?
To a degree, yes. It still is true to a degree. So,
is it because it cuts off circulation or what?
It leads to abnormal pressure in some areas of your legs. So therefore, it puts higher pressure on veins that are more distal.
Okay,
distant.
it makes sense, yeah.
So that can happen. Yeah.
Crossing at the ankles, I guess, then no longer at the knees. Shannon, thank you for calling in. We have Rebecca on the line. Rebecca, thank you for being with us. What's your question tonight?
What's the latest in lasers, and what is the difference between social downtime, and what does that mean?
All right. There's a lot of things that are new in lasers, and I think when Rebecca asked the question about what's new in lasers, I should expound upon that and say that in dermatology, we really talk about energy devices now, because we think of lasers as just being a light beam that's used to treat various conditions, anything ranging from brown spots to red vascular lesions that people don't like, broken capillaries of the face, used to treat wrinkles and the like. But now there are other energy devices that are used in dermatology. So other energy devices would be what's called intense pulse light. There's also using ultrasound energy, which is FDA approved to actually tighten the skin and lift the skin. There's also radio frequency energy that's also used to tighten the skin.
Could that be done anywhere on the body? I mean, I know a lot of people would like their face to look more youthful and tighter, but can it be done anywhere?
Yes, it can be. So it really depends upon the evaluation of the problem that people present with and what we see as being the optimal combination of things that can be done for people. And then now, also with energy, we also have dissolving fat through the use of cold energy. And so that's really fascinating, because who would have thought that if you correctly freeze fat while protecting the skin, you can actually get the fat to dissolve. And so people have probably heard of the term cool sculpting.
Yes.
And that is that process, and it was developed by several doctors at Harvard who came up with this idea from the simple observation that little infants and little toddlers who were sucking on cold lollipops, there would be some fat atrophy of their cheek from doing that. And so from that observation, they develop an elegant way of using cold energy to dissolve fat, and it's FDA approved for that, and it works very nicely for a lot of people.
Does it last, or is it something that you got to do every 6 months?
It lasts, but unfortunately, I'm guilty of this too, is that we can gain weight.
We have
over
our
time.
habits.
And so with that, sometimes we'll gain some unsightly new bulges that may need to get treatment. But the same is true when you do liposuction. And I used to do liposuction myself. And what I would always tell people when they had liposuction done is that what fat we remove, they're gone. But what fat remains, if you eat more and you gain weight, what fat cells remain will hypertrophy or thicken and get larger. So that can happen.
Interesting. Yeah. Okay, I'm learning so much here. I hope you are as well. We've got folks lined up. We're going to get to your calls and some Facebook questions right after the break. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Mostly cloudy skies to start your Monday. Soggy conditions to start, some dry time during the afternoon, and we've got more soggy conditions on the way. Scattered showers and storms during the evening hours, mainly before midnight. We should dry as we head past midnight tonight, although a few stray showers won't be impossible. Temperatures will stay mild with this system. The stronger cold front doesn't get here until Wednesday. Here's a look at current conditions across the southeast and, of course, right here in Nashville. This is updated on the hour. Bottoming out at 56 in Nashville tonight. Partly cloudy skies set for Tuesday. It will be a beautiful second day of your work week. 78 degrees, partly cloudy skies. Showers and storms return on Wednesday. Could see a few strong to severe storms mainly along and east of 65 during the afternoon hours before cooler temperatures settle in Thursday into Friday, especially Friday morning and Saturday morning. Notice those lows in the 30s. You may need to protect any sensitive plants outside.
If you spend any amount of time at the great outdoors, hunting or fishing, you need to watch Southern Woods and Waters on News Channel 5+. Join host Hugh McNaughton and our area's top sportsmen as they share their experience and knowledge. Southern Woods and Waters is all about Middle Tennessee, and it's live. Call in with your questions. Whatever the season, that's what they're talking about. Tune in to Southern Woods and Waters Thursday night at 8, or catch the encore presentation Sunday night at 8 on News Channel 5+.
The Leukemia and Lymphoma Society is focused on curing blood cancers. You can help us by joining one of our fundraising campaigns. Train with Team in Training. Walk to light the night. Sail with the Leukemia Cup Regatta. Become a man or woman of the year or a student that saves lives. Get involved. When you do, you're not only helping patients survive, you're helping them live. Join us.
Welcome back to Medical Monday. I have Dr. Binhlam here with me answering tons of questions about skin tonight. It's all about your skin. That's the topic. Dermatologist down in the Cool Springs area. We've got a ton of questions, but I don't want to avoid our Facebook friends here. Jack Lance wrote in about surgery for excessive sweating. I hadn't heard of a surgery. What are your options if you have excessive sweating?
Yes, so first of all, when you have excessive sweating, the dermatologist should try to figure out, is it due to any underlying health conditions, or is it what we call idiopathic, which means that it just happens and it could be genetic. Some of the common areas where people sweat excessively could be the armpits, it could be their palms, it could be the soles, it can be the face or other parts of the body. Now, when I talk with patients about excessive sweating, I tell people there's a stepladder approach to treating excessive sweating. You may want to start off with the most simple thing that can be done, which is the topical application of prescription aluminum chloride. If that doesn't work, then we move to the next step on the ladder of treatment, and that may be the use of Botox injection, which is FDA approved to treat armpit sweating.
And why does that work?
So it's interesting, but Botox does more than just relax muscles, because we typically think of Botox as being used on the face to help with facial expression lines caused by our muscles of the face. But it also blocks the production of sweat from the sweat glands. And so when you inject Botox, let's say in the armpit, the results can last up to a year at a time for individuals.
Wow.
So it can be very durable. Obviously the downside is going to be injections as well as the cost of doing the procedure, because a lot of times it's not going to be covered by insurance plans. The next level of treatment may be with oral medications, and typically we'll use oral medications called anticholinergic drugs that actually also block sweating from all parts of the body. When used properly, it can work very well for people who have multiple areas of sweating, where it's really impractical to use a topical product or to use also Botox injection. Then you have surgery, and surgery is, there are different levels of surgery. You can certainly use a device now called the mirror dry, which is using microwave energy to surgically destroy sweat glands and ducts in the skin. And then a more invasive type of surgery would be called sympathectomy, which is where a surgeon would actually go in to the thoracic spine, or whichever level of sweating that you have on the, say, the armpit or the hands or the feet, and they cut the sympathetic nerve, which is responsible for leading to excessive sweating. The problem with that is that there are surgical risks that comes with it, because when they go into the chest wall cavity, you may get a collapsed lung, may get an infection. And then the other thing that's also very troublesome is that you can get a compensatory sweating elsewhere. So that means he may cut a nerve that will lead to ending the sweating of your palms, but then another part of your body
Takes
compensates
over,
and then sweats a whole lot more. So that could be problematic.
Okay, good to know on that one. Jack, thank you for your question very much. Terry also wanted to know, he has very thin skin, and sometimes just working in his shop or just touching his skin, it looks like a blood rash. What can cause this?
So we see this very commonly in people over time as they get older, but also people who've had a lot of sun exposure over their lifetime, because actually that also leads to thinning of the skin when there's excessive sun exposure. When you have those factors combined with the fact that people may be taking medicines to protect the heart, such as a low-dose aspirin, or they're taking ibuprofen that's used to treat arthritis-type pains. Those are blood-thinning medicine. If you drink some alcohol, that's also blood-thinning. If people take some supplements, such as St. John's wort, ginkgo biloba, those things actually also thin out the blood. So little trauma will cause the capillaries in the skin to rupture more easily. Then you get these purplish patches on the skin. And one of the troubling things with that for a lot of people is that over time, the blood that leaks out of those capillaries will stain the skin. And then we start to see a lot of discoloration in the skin from the blood products that leaks into the skin.
Yeah, I think we've all seen that on people. Okay, let's jump back to the phone lines. We have Andy. Andy, thank you for calling in tonight. What's your question?
My question is, I have skin cancer. It's not melanoma on my cheek. And how many times can you freeze it before you need a Mohs procedure?
Wow.
A interesting question. So let me explain for the audience what he means by Mohs procedure. Mohs micrographic surgery is a technique for the removal of skin cancer with margin control to make sure that you've removed it completely. It was named after Dr. Frederick Mohs, who developed that technique, and now well-trained dermatologists do use that technique to treat skin cancers in high-risk areas. And high-risk areas would be, for example, around the eyes, around the nose, around the lips, around the ears, and even on the cheek, because those are areas where the skin cancer can actually grow along what we call embryonic fusion planes, where it can spread more widely underneath the skin. Now, if your skin cancer was previously treated, let's say, with excision with margins before, but they did not clear it, then that would definitely be a reason to consider the Mohs micrographic surgery technique to make sure that you have margin control. And what's different about Mohs micrographic surgery than regular excision is that when the site of the skin cancer is worked on, the tissue is processed while the patient is still in the office, and 100% of the margins is looked at by the Mohs surgeon to make sure that there's clear surgical margin before they stop. With regular excision, when it is sent to the pathology lab, usually only about 20% of the margins are looked at and read out as being clear or not clear. So because you're not examining 100% of the margins, then you cannot actually guarantee that you've got it all gone.
So when you're done, when you're doing this procedure, you can guarantee that, okay, we got the cancer, it is now removed.
Right. Success rate with that is going to be like 99%.
And I think that Andy said, how many times can you have something frozen off before you need to have this Mohs? What do you tell a patient?
Yeah. So typically in my practice, we do not freeze skin cancers. The best way is going to be some surgical technique if people are good surgical candidates. And when I say good surgical candidates, it would also mean that it's someone who is healthy enough to undergo surgery, as opposed to considering other treatment options for skin cancers, because for example, now with basal cell carcinoma, if someone's not a good surgical candidate, there is now an oral medication that people can take to actually cause the basal cell carcinoma to regress and go away. There's also radiation, also as a treatment option for people who are not good surgical candidates. But whenever possible, you want to have surgical removal with margin control to make sure that the cancer, once it's taken care of, it's gone and you don't have to deal with it again.
Yeah, absolutely. Andy, best of luck to you there. Let's hop to Debbie. She's been waiting a while. Debbie, thank you for your patience. What's your question tonight?
Yes, what are the options for facial aging?
Good question.
Wow,
all of us want to look youthful and at our best. So where do you start?
Right. I think the foundation of helping with aging skin is always going to be good photo protection, which we kind of addressed a little bit earlier by saying you always want to use sunblock with SPF 30 and above. A second thing that has good scientific data to support it is the use of tretinoin, otherwise people know it as Retin-A, that if used on a daily basis, it actually over time will help reverse some of the visible signs of aging, such as blotchy skin, fine lines.
What's the difference? I'm going to interrupt you real quick. Difference between Retin-A and retinol?
So retinol is a precursor to Retin-A. It's not as quote unquote strong as Retin-A, which would be by prescription.
Okay. Gotcha.
So a lot of people may start off with retinol because their skin may not be able to tolerate a higher strength tretinoin or Retin-A product. So they start off with retinol. And in my practice, what I like to do is gradually build people into be able to use tretinoin or Retin-A.
Okay, so that's supposed to reverse the signs, is what you said.
That's right. That's right. Now, in terms of reversing the signs of aging, it all depends upon where you're starting from. Because if you're starting later and you have a lot more obvious signs of photoaging and aging in general, such as wrinkles, such as poor skin color, where you can have brown splotches, redness, you can have enlarged pores, skin that doesn't look as healthy, it looks more sallow, then you need to look at more aggressive things such as medium to higher strength chemical peeling of the skin or laser resurfacing of the skin. And with laser resurfacing of the skin, there are now two categories of resurfacing. You can do what's called ablative resurfacing, which is where you're really stripping off all the layers of the epidermis and part of the dermis, and you're causing people a controlled second-degree burn, and you allow new skin to come in, so that's a lot more aggressive. Or you can do what's called non-ablative resurfacing, where the laser energy enters the skin and it causes a wounding underneath the skin that causes the epidermis to actually slough off, but there's no open wounds, and that treatment actually is much easier on the patient in terms of recovery time. And again, a couple of dermatologists up at Harvard developed this type of non-ablative resurfacing that is called fractionated non-ablative resurfacing, and people may recognize the name of Fraxel because that's something that has been the buzzword for many years, and they were the leaders in that technology.
You know, I think Rebecca called, I think it was Rebecca said, you know, let's talk about downtime with these different lasers. And I don't think we got to that before. So whether we're doing the full Monty of the, you know, the big shebang, or we're going with the less invasive one, what kind of downtime are we talking about? Where you kind of got to stay inside, or people are going to say, what in the world did you do?
Right. So if I can share with the audience, you know, pretty much every laser that or energy device that I've had in the office, I've used on myself. And so we do distinguish between what is truly downtime versus social downtime. And social downtime is time in which you may not want to be in front of the public eye just because you may not look as good, but it's not truly downtime because you have no raw open skin. So if you're going with a procedure, let's say for example, for helping with wrinkles and dyspigmentation of the skin, and you're going with a non-ablative laser, that the Fraxel, and I've used that on myself, the typical social downtime is about 7 to 10 days. and it's very predictable. If initially your skin will look more reddened and a little bit more puffy, like you've had a sunburn. By day 3, the skin is going to feel rough, like sandpaper, and what you're seeing there as little dark, rough sandpaper skin is actually the epidermis that's been destroyed, so to speak, by the laser energy, and then over the course of 7 days from that, it just naturally sloughs off. There's actually no true downtime. When I've done it on myself, I've even gone out and just played golf the next day. I wouldn't advocate that for my patients, but I've done that just because I know that's very safe.
Gotcha. Okay, very interesting. We're learning so much. I hope you're enjoying this and getting your questions answered. We're going to have to take a quick break. When we come back, more of your questions. Stay with us.
Don't miss the floor model clearance sale going on now at Beds & More. Select bedrooms, sofas, sectionals, recliners, and more have all been marked down for immediate sale. Save up to 50% on select twin, full, queen, or king mattress sets. Stop by today and register to win a $5,000 home makeover at Beds & More, located in Madison Square Shopping Center on Gallatin Road.
And remember, you'll catch more Z's at Beds & More.
If you want to shed the fat and sculpt your body to get that slim, sexy look of your dreams, then you need to stop working out. Say what? And start rocking out with Rockin' Body, the fun new body makeover system that was created by fitness expert and insanity creator Shaun T.
Rockin' Body combines dance and fitness in a fun new way so you can achieve insane weight loss.
I lost 30 pounds dancing.
Now you can tone and tighten your abs, shrink and shape your hips and thighs, and lift and firm your booty, all while you're just dancing.
I've lost 33 pounds. I feel sexy.
And now, for a limited time, the complete $80 Rockin' Body system is 75% off. That's right, Rockin' Body is only $19.95. We'll even upgrade you to express shipping free. Get the complete Rockin' Body system for only $19.95.
Call 1-800-307-0417 or order online at rockinbody.com. 1-800-307-0417. Call now.
I believe in you. Just 4 simple words. But to a child in need, they mean the world. I believe in you means you have potential. You are special. You matter. When you support a child through Save the Children, you're saying, I believe in you. Your help says to a child, I believe that you deserve a successful start to life and a solid foundation to build upon. I believe you're worthy of good nutrition, quality health care, and the opportunity that education unlocks. Becoming a Save the Children advocate sends a powerful message of support. It says, I am here for you, to lift you up, to cheer you on, and to celebrate your success. I believe in you. Just 4 simple words that can bring hope, that can change a life. Visit sponsor.savethechildren.org/believe today and tell a child in need, I believe in you.
Your day moves by pretty fast. Chances are you missed something.
Before you call it a night, let us catch you up on everything you missed
and get you ready for a busy tomorrow.
Watch News Channel 5 at 10. Then rest easy
knowing the last word on everything that happened today.
And feeling ready for whatever happens tomorrow.
Get the last word on everything new.
Watch News Channel 5 at 10.
Welcome back to Medical Monday. We are talking about your skin today with dermatologist Dr. Binhlam, and we appreciate you being here and answer all of these questions. Morgan has been hanging on the line. Morgan, thank you for your patience tonight. What is your question?
Hi, I was just wondering if you could tell us a little bit more about some of the new psoriasis medications, because they sound a little dangerous on some of the commercials.
Hey, great question. You hear the last part where they go through all the side effects really quickly and in this different tone, and they do sound scary. We were just talking about psoriasis and what an impact it can have on your life physically, but also mentally.
Right. So I'll first start off, just because some of the audience members may not be familiar with psoriasis. Psoriasis is a type of inflammatory disorder that affects about 2% of the U.S. population, and it leads to thickened skin lesions that are very red and scaly that can appear on any part of people's skin, including the scalp. and it also can affect the nails, to damage the nails, and it can also affect the joints. About a third of individuals who develop psoriasis of the skin will also develop what we call psoriatic arthritis that can lead to deformity of the joints. Now, saying that, in the past, the treatment for moderate to severe psoriasis involved the use of certain chemotherapy medicines such as methotrexate. And while we would use it for people with severe disease, dermatologists as a whole, we were concerned about long-term effects of using such a chemotherapy medicine for skin disorders. And so over the last, I would say really 10 years, there have been innovations in dermatology with regards to treatment of psoriasis that include a class of medicine called biologics. And these are medicines that very selectively affect the part of the immune system that is overactive, that leads to the proliferation of skin cells where the skin gets to be too thickened. It also has benefits for the joints because if people have psoriatic arthritis, a number of these biologics also help prevent damage to the joints and alleviates the symptoms of joint disease. Now, the people who are familiar with biologics will know that the FDA officially classifies them as immunosuppressive medicine. And while they are partially immunosuppressive, there is a strong body of literature that supports that they are very safe to use, where long term, and we're talking about over the last 15 years or so of use, there has been no increased uptick of infections or conditions that are related to suppression of their immune system. Saying that, we would use those medicine very carefully, and we always monitor people carefully to make sure there are no problems that arise. There's also a new medicine now that's also available. It's an oral medicine. It's called Premalas, and that medicine people can take orally, and that one does not have any effects on the immune system. And that can work, although this is from my own personal experience. I do find that the biologics work much better. People have more severe disease than that oral medication, but it's certainly treatment options. Then you also have other options that are unique, that for localized conditions, let's say of the scalp, we can use actually a laser. There's a laser that's FDA approved to treat localized psoriasis in different body areas.
Is it pretty effective?
It absolutely can be very effective, and it's called the eczema laser. The biggest potential downside for people is the fact that they do have to get a series of treatment, and I usually tell people you need to anticipate at least 20 sessions with the laser in order to see good clearing of psoriasis.
Is that something that would be covered by insurance?
Typically it is.
Wow.
Typically it is. And certainly there are also newer, higher potency topical steroids and what we call immunomodulatory topical medication that can also be used for more localized area of psoriasis without having to go to the more, I quote, high-powered medicines.
We've talked about lasers and the ultrasound and the different lights and that sort of thing for different types of treatments, whether it's trying to get the brown spots out or eczema. What kind of pain are we talking about with laser treatments?
So it varies. It varies. And I usually tell people if there is no discomfort, then we're probably not making much change in the skin. So most of the time the level of discomfort is very tolerable. And I usually tell people, let's say for example, if we're treating broken capillaries on the face, it'll feel like a little grease splatter on the skin every time the laser is fired. And then the level of discomfort can increase depending upon the setting that we choose to treat more resistant skin conditions. So that can hurt more. Certainly with use of ultrasound, radio frequency energy, Pretty much everything has some degree of pain, but they all can be pretty much controlled for the most part, which is topical anesthetic. Now, interestingly, we had talked in an earlier segment about the use of cold energy to dissolve fat. Actually, that probably is one of the least painful procedure because it's a device that clamps an area of unwanted fat, so it actually will cause a numbing of the tissue, and you actually don't feel anything at all.
So you're losing fat and you don't feel it.
That's right. So it's really interesting in that regard. So it's very well tolerated by people.
Very interesting. Okay, Audrey is with us tonight. Audrey, thank you for calling. What's your question?
Hi, thank you. Yes, I have some questions about Botox, and I'd like to know how long can I anticipate Botox lasting, and would there be any reason that I wouldn't be a candidate for Botox?
Okay, Audrey, let's get those answers.
Right. So Botox, or botulinum toxin, has been available in the last 20 years to help with muscles of facial expression that leads to wrinkles such as the frown area, the forehead lines, the crow's feet area. And in general, the effects of Botox is dependent upon how much Botox you use for any one area, because the more relaxation of the muscle that you provide, then the longer it will last, and it can last anywhere between 4 to 6 months. Some people, though, still want to retain some facial expression, so they don't want to have that frozen look.
Right.
So we can always fine-tune the amount of Botox that is used so that people get a relaxation, but they don't have a frozen expression. So that will look more natural. As far as who can get it, well, pretty much anyone who is an adult. Okay.
You want to do this too early.
That's right. And also, they do not have any history of allergies to any of the components of Botox, or have any rare neuromuscular conditions that would prevent them from getting Botox. And that would be very unlikely, and that's something where whenever someone's contemplating getting Botox injection, they should go in, talk with the dermatologist, and give them their medical history, and then that will help the dermatologist decide if it's appropriate for them and how much to use.
Okay. I just have a quick question. We only have about a minute left, but with all these new fillers and Botox and resurfacing, are facelifts a thing of the past?
Interesting that you should say that, because the number of facelifts that are done by surgeons are actually decreasing in numbers over the years. And people are looking for more natural, non-invasive things that can be done, and putting off face lifting for much further down their lifespan. Now, certainly there are people who would be very appropriate for plastic surgery to do facelifting if the amount of loose skin that they have is so much that really these other modalities cannot work. But for the most part, if people start a little bit early, before things get to be, so to speak, too bad for them, then you can do a lot of things that really puts off doing an invasive procedure like facelifting for many, many, many years.
Okay, interesting. On that note, we're going to take a quick break. When we come back, we will wrap things up.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Mostly cloudy skies to start your Monday. Soggy conditions to start, some dry time during the afternoon, and we've got more soggy conditions on the way. Scattered showers and storms during the evening hours, mainly before midnight. We should dry as we head past midnight tonight, although a few stray showers won't be impossible. Temperatures will stay mild with this system. The stronger cold front doesn't get here until Wednesday. Here's a look at current conditions across the southeast, and of course right here in Nashville. This is updated on the hour. Bottoming out at 56 in Nashville tonight. Partly cloudy skies set for Tuesday. It will be a beautiful second day of your work week. 78 degrees, partly cloudy skies. Showers and storms return on Wednesday. Could see a few strong to severe storms mainly along and east of 65 during the afternoon hours before cooler temperatures settle in Thursday into Friday, especially Friday morning and Saturday morning. Notice those lows in the 30s. You may need to protect any sensitive plants outside.
Listen, I realize that I'm not perfect, but it all really started to change because you judge me for having a problem. No one is going to know that I need help. I need help. I know that no one is going to judge me for having a problem. I realize that I'm not perfect, but it all really started to change because you listen.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
Thank you for being with us for this Medical Monday, and thank you to you, Dr. Binhlam. Now, I have a question for you that runs the gamut here. Who should come see a dermatologist?
That's a very good question, and I really think that when people think about a dermatologist, we're not just the doctor who deals with things such as rashes and acne, and certainly we deal with that, but dermatologists are experts in the treatment and management of skin, hair, and nail diseases, as well as we are the experts in dealing with how to help people not only maintain skin, hair, and nail health, but how to improve it. So our specialty is unique because we encompass a broad range of not only medical services, but as well as cosmetic services.
And we appreciate your expertise. If you want to get a hold of Dr. Binhlam, the information is on the screen. Have a great night.